We will start the meeting, doctor.
Okay. All right. Saqib Bhai? Hello, Saqib. I think your sound is gone. Saqib Bhai?
Am I back now?
Yes, you're back
Okay.
now.
Okay.
You know it. Say Bismillahir Rahmanir Rahim. What's happening here?
No, we can able to hear you, sir. You please go ahead.
Yeah, you can hear me, yeah?
Yes,
Yes,
everybody can hear you.
All right.
Please
Good.
continue, sir.
We have this organization called Lifecare. This is for the information of Dr. Kaviarasu. Basically, what we have done is we are trying to bring all life care activities, which includes looking after people and persons and patients, and looking into their lifestyle, health, everything around what keeps their life active, efficient, and well, healthy and well. It's a wellness sort of revolution. And this we have been going on discussing, but at this stage, we're beginning to crunch on certain important areas that we need to look into. And by this, we bring in various forms of therapies, guidelines, everything together. And then we are trying to use, of course, definitely yours is one of those highly evolved thing, a little higher than the average day-to-day life care, okay? Where people who have born with deficiencies and things like that, you are helping them. So we'll be very pleased to work with you and your group. And in the long run, Sakibai and I will have a website which will define a few of the participants. One is the client. They are not patients. Most of them may be even normal people. Yeah, learning, preparing to understand what to take for the breakfast and what to take for dinner and things like that, and how much exercise is walking good for them at their age. Can you do this and all sorts of things, and the senior health and things like that. All that is being combined into one sort of scenario. And we also have people directly communicating. So that's the client. The next one is the providers. We take in experts, providers like you, and even ordinary providers who can just go one-to-one and deal with one of the clients having something worrying them about their life and life care, lifestyle, and their wellness and things like that. So I think that is the second part of it. And the third will be the administration of this. We will also prepare learning material to empower people to avoid getting into situations which will take them to be hospitalized and things like that. The fourth level is institutions which will participate with us. So we have the client, the providers, the administrators, and the institutions. So you come under an institution. So that's one of the institutions to look into people who have deficiencies and unfortunately born with deficiencies and things like that. So that's my summary. And it will be a great thing to be preparing things that can be applicable to the 8 billion population that exists in the world today, from this point of view.
Yeah, thank you, sir. Once you finish, I
have just finished my summary. So you can just discuss about what you are doing, and then we'll be thrilled to hear what you are doing.
Okay.
This is being
So,
recorded, if you don't mind, and
no, you can go ahead. Go ahead. No
also
issues.
we will be producing a summary of it using the AI of the Zoom itself, and then I will send it to you. Eventually, we can have something like a minute.
Okay, wonderful. So, we are into nanomedicine and
Okay.
quantum medicine. We are okay. So, I will share the
Can you
slides.
explain nanomedicine and quantum medicine briefly, very briefly?
Yeah, see, what happens is our brain is covered by, as you know, the blood-brain barrier.
Yeah.
So unless a particle having the size of 20 nanometers to 100 nanometers, it doesn't cross the barrier.
So in other words,
And
we need to deal with the brain.
exactly. So we are dealing with the
We are able,
brain.
you are able to reach it because you are
Exactly.
practicing nanomedicine. Yeah.
Exactly.
Okay.
Exactly.
Okay.
So that is
Sorry,
so
for everybody to know. Fortunately, we
okay.
have only 2 or 3 people, but anyway, okay.
Yeah, yeah. So the this is as far as the physical properties are concerned. The particle should be nano in nature, and it should be between less than 100 nanometers. And the second thing is it has to get transported properly. So this nanomaterials has to be packaged properly, and we should attach a carrier to it, and it has to attach a receptor to it, and make this nanomaterials propagate in the bloodstream and reach a specific point in the brain. So this is target specific nanomedicines. This is not just nanomedicines.
Okay.
There are target specific drug delivery, and what we do is we personalize this nanomedicine for an individual. So we have a very advanced software medical device. This software medical device is in the early stages of its evaluation, but it works very beautifully. See, what happens is whether it's a child or whether it's an adult, we will just discuss about the child, then we go to adults. When it comes to the child, it is a neurodevelopmental disorder. So when a child born, so there is no mechanism today to find out why this neurodevelopmental disorder has come to this child and what kind of neurodevelopmental disorder the child has at the time of birth.
Yeah.
We don't have that. The only choice is genetics, but the accuracy levels are very poor as of today.
Genetics and epigenetics. The reason is it's more
It's an
developed.
epigenetics, and the accuracy levels are very poor. Only at the age of 4 they can able to conclude precisely whether the child has what kind of neurological disorders. Even then, there is no solutions today which can guarantee that okay, you have this. This is the duration. Your child can come out of it. No one can say that. So fortunately, with the God's grace, we have something in our hand. We can able to give this kind of commitment to the parents and and the caregivers that okay, this is the issue or these are the issues. It starts with autism and spectrum disorder, attention deficit hyperactive disorder, intellectual delay, then cerebral palsy, epilepsy, speech and communication disorder, and
These are you are determining it by the quantum physics and quantum energy
exactly,
network.
sir.
Yeah.
We solved this. We have a path-breaking discovery as far as the Google and Chat GPT and Google is concerned. It says it's a path-breaking discovery.
Yes.
So this discovery now we are in the process of bringing into legalities, and we want to introduce as a software medical device. That is the
Yeah.
correct
It is the
terminology.
quantum physics and quantum energy because
Exactly, sir.
I have
Absolutely.
an
It's quantum
engineer.
physics and biology.
There's an engineer working in, he actually the retired chief of engineering. He has developed some interesting features. I didn't want to bring him in now, but I thought we will discuss first and bring him in. And he's developed, for example, the pacemaker that you put in, if you want to recharge the battery, and he has developed a remote device that will recharge it without opening and taking the pacemaker out. And similarly,
called
he has developed certain access to access and distribution of some of your advanced technologies to reach the cells and reach the target. And this sort of energy can be useful. Is that right? Or
Yeah, sir, this is a different thing which what you are talking about. This is something called near field inductive coupling. So what it does is, no, there is something called near fields, near electromagnetics,
yeah.
which induces the potential in the coil which is in the pacemaker,
Yeah.
and where there is a rectifier which charges the battery fitted in the pacemaker. That is one thing you are talking about. Second thing is, yes, you can use magnetic fields to guide the magnetic nanoparticles to the tumor. So especially to the cancer cells. So this is, now I'm talking about something else. I'm talking about, how the nature has designed the genetic code of an individual, and know how the human, a specific human is designed by the nature. So this is helps to personalize the medicine. When you say personalized medicine today, on what grounds a medicine can be personalized to an individual? It's a big puzzle which has not been solved, and we have a solution. So nowadays, everyone takes an American supplement, the best in the world, most expensive, and prescribing it. But it's not like us. If an individual come to us, we can able to very precisely assess what kind of
Needs.
stuff is missing, which
Yeah.
endocrine gland is not functioning properly for this individual, or which hormone is not secreting properly for the individual, and accordingly we can able to tailor the supplement to an individual. That's what is our expertise.
That is
Okay.
personalized.
Yeah,
Personalized.
personalized. Yes, sir. Yeah, we have developed a software medical device to personalize the nano and quantum supplements to an individual. So this is what is our we are doing. And when it comes to, as I mentioned, when it comes to children, we have a wide range of neurodevelopmental disorders we can able to cover. And when it comes to adults, we are experts in anti-aging, and we are experts in anti-aging and reproductive health. So across
I work in the
India,
field of reproductive health anyway.
yeah.
I'm an
So
obstetrician gynecologist.
we can able to program the sperm of a man, whether it's a head defect, we can able to correct it. Whether it's a no body defect, we can able to correct it. If there is a tail defect, we can able to correct it. We have 3 different nano compounds, nano supplements, which can be helpful in promoting the reproductive health. So and in the 2023, 3 people got Nobel Prize for quantum dots. That is for industrial application. But we have developed quantum dots for biological application, and we have been using it for a long time. But it is not still undergone the proper clinical trials as per the current science, which we are going to do it in the next coming months or year. So I am just summarizing my thing. I am offering 3 things to you. One is a personalized nanomedicine and quantum medicine for neurodevelopmental disorders. Second thing, when it comes to adults, we have medicines for very nice formulations based on gold nanoparticles for anti-aging and reproductive health. And we have a software medical device which can able to personalize this,
Just
or
one second,
able to
please.
diagnose.
Can I stop you for a minute? Hello,
Yeah.
Mommy. You like to join our meeting if you like, Zoom meeting. We are talking about quantum AI and related to anti-aging and things like that. It's a Lifecare meeting. If you like, you can come and then you can listen. Okay?
It's on Zoom.
Zoom, yeah.
I have to get the details, isn't it?
Zoom details, you have it, and I can send it to you if you want. Okay, I'll forward it to you now. The meeting ID and password. Sorry about that. That's my wife was calling.
Oh my God. Okay. Please attend to it.
Yeah, she wants to, she will be interested in this, what you are talking right now.
Oh, okay. If you bring I'm not exaggerating, sir. If you bring a 60-year-old woman, you give me 100 days, I will convert her into a sweet 50s. or less than 50. No wrinkles, nothing. I can remove all the wrinkles,
we are
elevate the energy
dealing with
level.
these situations now. I think my wife is a doctor as well in yeah,
Okay, okay.
do you mind if I just go out of this and then or send you the thing, you come and join us? Okay, thank you very much. That's my wife, and I thought she will be very interested. That's why, sorry, I stopped you, and
Okay.
I'll send the information I have. She has the information, but every time she has to be told again and again. Just a minute only, yeah? If you don't
Yes,
mind.
yes.
She will definitely benefit from what you're doing, so that's why I thought. Okay, we continue then. Sorry.
Okay. So this anti-aging, when it comes to adults, we have expertise in anti-aging formulations,
Yeah.
which can help to extend the life as well as improve the quality of life.
Yeah, okay.
And second thing is, yes, we are good at reproductive health for both men and women. So that is where when it comes to adults. So this anti-aging medicines, of course, it covers, the Alzheimer, dementia, and those
Yeah,
kind of situations also.
definitely, yes. Those are deteriorations. And of course, there is a lot more being discovered as we go on. And I think they should be applied and used, and people should benefit from that. Yeah.
Yeah. Yes.
Because
Yes. We can help the men and women to prepare themselves for a marriage life, and we can help the women to live a quality life during the pregnancy, and we can help the women to during the lactation period to improve the quality of the mental health of the child. So
yeah.
during the lactation period, yeah. Yeah, I'm stopping with this. So now you can continue, sir.
Yes, Saqib Bhai, you have any comments?
No,
Saqib
Dr.
Bhai?
Mahroof, you please to continue and we will just observe. Yeah, please.
The main thing is for us to establish a link that we will recruit people for this process in Saudi Arabia and the Middle East. And we will discuss the business plans and things like that eventually. And that's why Brother Aslam is here, Aslam Nawab. And we will go ahead and start making a very scientific presentation, which I can make to groups of people that I meet regularly in here. We have people who are in the 60s, and when they retire, they form into groups, and they
Oh,
meet together every week on Friday afternoon and every day in the lunchtime. So these groups, when they come together, they discuss a lot of day-to-day problems that they have
okay.
right now. As during their working time, they were so busy they didn't look into this. Now they have a thing to think back and say, what can I do to have a quality life?
Oh,
So in
okay.
order to do that, they need scientific explanation. And I have a few presentations that at the moment I'm not ready to present it, but I have a few presentations which gives sort of not extending life as such, but improving the quality of life in order to live its total potential. In my opinion, we have the centromere, which is working with the telomere part of it, which is about 22. And each of those telomere is capable of handling life up to 10 years for
Okay.
each of the cells, and minimum of 7 if you look after it well. So 7 to
Okay.
10, if you put 7 at the minimum and then multiply it by 22 telomeres, so which is every time it multiplies, it loses 1 telomere, then they should be
Okay.
living to 154 years, so simply, but they don't. So your type of research is the one that is going to bring what are the deficiencies that should be corrected, and what are the other finer chemicals and indicators that tell us where the problems are, and then we can correct
Exactly.
it. So,
Exactly.
so we form a sort of synergistic group which will bring for the humanity some points which makes you live. That's in fact, we see it in our life, but we don't realize what it is, because we do see people who are older but look younger, and you are younger but look older. And
Yes.
these are the people from whom we draw examples. And if you analyze them chemically, hormonally, cell-wise, function-wise, then we may be coming out with, and you are doing that particular research, and you're bringing up answers for these questions. Isn't that right?
Yeah, you are right, sir. Yes, we are into it. Yes.
So we'll be very glad to work with
We are into
you.
predictive diagnostics
That's right,
and
predictive diagnostics,
preventive care.
preventive care. Both
Yes.
of them. Today, prevention means preventing illnesses and diseases. No. Preventive care also, a deterioration of your capabilities and life activities is also or deficiency.
Yeah, you are
Uh,
right. You are precise.
Dr. Mahroof,
Yes.
I'll request Dr. Kavi to please help us understand his predictive diagnostic methodology, modus operandi.
Okay. So when it comes to predictive diagnostics, no, we are doing it for two sectors, as I mentioned earlier. One is for the infants, newborn and infants. At this moment, in the future, we will be, we'll be working, one more advanced level during the neonatal stage itself. That is during the pregnancy itself, we will start working with the women to reduce or minimize this the number of occurrence of newborn children with neurodevelopmental disorder. That is
Anomaly.
what we are talking. So that is that's what predictive diagnostics. When it comes to the elderly people or adults, no, the old people, then we can able to say that no, we can able to detect whether the person will get into a cancer cycle, or the person will get into neurological issues, or which kind of organ will be affected. Most likely will get affected when this man become aged. So as I mentioned, we have a path-breaking discovery which has been connecting astrophysics, biology, and nanomedicine. So this is first of this kind, and we are yet to patent this, and we are in the process of developing it further and getting the approvals. So that's where we have enough data today to climb, to support our climb, and but we are into the legal framework of converting this into a software medical device in terms of approvals.
Now,
Yeah.
Dr.
So
Mahroof,
if you have any questions, you can ask me.
Dr. Mahroof,
Yes,
if we have to go to the Ministry of Health, Saudi Arabia,
yes.
for approval, what sort of data we need to present?
Actually, they have got now today, how does medicine progress? Medicine progresses by research and records and analyzing them and proving that it is beyond just a random chance. It is done definitely due to certain effects of some of the things that we are doing. So that's what Kavi is trying to say, that he has developed some of those things he had identified are actually he's trying to patent them. Once it is patented, then we can distribute. Because once he has already proof from his research, he has already have information that is working in people.
Do you mean patented in India?
No, they want to patent it
we have not
across the world.
patented
Why
anywhere.
in India? It is for humanity.
Yes, Dr. Kavi, is it global?
Yeah, it is global, sir.
Patent
Okay.
is global.
No, according to the best search engines in the world today, it says it is a path-breaking discovery. So, and whatever the guidelines required to convert that into a software medical device, we are almost fulfilling all the requirements. Only thing is, we need to apply this for in each government there are different bodies. So we need to talk to them and produce the papers and get this approval done. But it's quite possible
It is
because
possible.
this
I think I think we can start in Saudi Arabia. There is one interesting thing that happens, Kavi. I want to. Can I mention that?
Yeah,
So,
please, sir. Most welcome.
So this is where the whole world, people from the
Yes.
whole world, one end to the other end, they all
Okay.
come to Saudi Arabia. If there are Muslims, they all come for Umrah and Hajj.
Okay.
Nowhere in the world does that type of group come from all over the world. And I worked in the health management system of Hajj and Umrah, and where I could find out diseases and treat them. But I had no chance to give them advice what to do next or what they could have done before. Because I
Okay.
had no
Okay.
control.
Sir.
So what we can do as a group, we can move into from the access point where we meet them, we can go to the governments and tell them this, we would like to apply to your Umrah passengers if they like, and for they came to be kept. So there are some guidelines I have developed called 1 minute.
Now, Kavi, Dr.
Yes.
Kavi, in the meantime, please, now when you say,
1 minute, Saqib Bhai.
yeah, go ahead.
So this, no, I have to get rid of this.
Now, when you say, Dr. Kavi, that it has been said a path-breaking discovery, how do you Google it?
Yeah, because when you ask ChatGPT about your claims, the ChatGPT does the entire global survey and it says as there is no such thing available as of today.
Right. No, but what is the question like
today,
that we should ask?
It asks n number of questions before it concludes that this is a path-breaking discovery.
Right. But
even
what
it
is
asks me how many sample data you have, in what format you have, everything. It has been a long conversation I had it with artificial intelligence.
Right. No, I just wanted to know the question. Just the question which is to be asked.
Yes.
From these AI tools.
Yeah, this is the sort of guidelines for Hajj healthcare. So,
sir, I have a happy news for you.
Yeah.
Can I share it with you?
Yeah, sure.
I worked more than 8 years for Hajj ministry.
Good.
I was the only Indian consultant in the history of Saudi Arabia.
MashaAllah.
That's good.
See, I worked with King Fahd University in Dhahran.
Dammam, yeah, Daharan.
I worked with King Fahd University of petroleum, oil, and petroleum. So I worked with the computer science department, and there was a place where every year there was because of congestion people die. I'm talking about 15 years back.
No,
2000 to
during
3
that time, I was one of those people who was supervising, training the doctors.
Okay. So there
Right. So I was in charge of this
people died.
Hajj healthcare, and I have seen. I walk into a place, I see thousands of bodies in the Mina. Mina is a place where they stop over. Thousands of patients. So I am going to supervise my doctors, and I suddenly saw this. I had to go into action, treating them. So I had to take off my gutra, igal, and throw it away, and then take my top and tie it up, and then keep on working. So I worked in healthcare life for about 10 to 15 years.
No, I worked for nearly 8 years, sir. Actually, I was there in Saudi Arabia once. I was in Saudi Arabia, and I worked with the computer. The Hajj Ministry has given the assignment to the King Fahd University Computer Science Department. If you type Dr. Kaviarasu Balakrishnan Hajj tracking, you will get lot of research papers. Okay, we developed the entire tracking system for this Hajj. But later on, the technology was implemented by some big company in Saudi Arabia. But the basic technology, everything has been developed. The design has been done in India, and it has been the entire hardware design done in India and given to King Fahd University. They developed the software and they integrated it and they deployed it. I think I'll be very happy if you bring one more opportunity to do something for the pilgrims.
Yep. We can, because with my background and your background now, I think we have something that very interestingly, we can fit into individuals.
Exactly.
And
So
it is offered to the whole world, not only people who are doing Umrah or Hajj, but also the others. Do you understand?
Yes, sir.
Basically, as a matter of policy, when the Hajj and Umrah visa is issued, there is a health check which is being performed, and we are already working if we can influence that at that level when before the Hajj and Umrah visa is issued, and all that health data and health report which is being approved, that goes through the process that we introduce.
No, the process is the one that I introduced long time ago, eventually, because I work for the Hajj ministry. Even now, I have links with the Hajj ministry in getting some advice. So I think they come to me sometimes. But basically, what we can do is, what he's saying is, all these things we can put it across to them, and it will be eventually enhanced in quality in terms of utilization. We can utilize it for the future Hajj and Umrah. And this will be very good. So, and we are in the we are in the 6th month of Islamic month. We got another 6 months to go before Hajj. So I think we can put in some of these factors. If we can suggest, I can contact Khalid Al-Bar is my close friend. He's a physician himself, and his cousin is a Hajj minister. So I can bring him in next time into the meeting, and then we can discuss this.
It will be a great thing, sir. Because if the Saudi takes the initiative, the entire 65 Islamic nations will follow it.
Yeah, we can. In fact, I have earlier on, who was that? Earlier on, my friend called me and he introduced me to Dr. Baksh. And Dr. Baksh is one of the well-known physicians from Makkah. And he has some knee problems. So I was trying to contact Muthukumar, who is my close friend, and also the spine surgeon from Madras. And so I'm trying to put them together. In the meantime, I will also communicate with them and try to get them into our group.
Dr. Mahroof,
Like, we can take the initiative to move some of the basic things. Now we need to write up a simple thing based on our minutes of this day's meeting to develop some guidelines based on high technology, so-called nanotechnology, we call it nanotechnology and quantum physics. Okay?
Dr.
Yes,
Mahroof,
fine.
Dr.
Yeah.
Mahroof, for your information, Dr. Baksh is a family. It's part of our family.
Part of your family.
Yes,
Okay.
my elder brother's son is married to that family.
Okay.
Yeah.
I
You know, when I
Dr.
came in July,
This afternoon, I spoke to Dr. Baksh.
small word.
Yeah, that's right.
Yeah.
So, inshallah, when we start moving, write the basics and develop this and move it, it'll be good. And also, I must mention, there is a friend of ours and also Aslam Bhai's friend, who is Nawaz Ashraf. He's
Fawaz.
Fawaz, sorry, Fawaz Ashraf. Why you, because you are influenced my Nawaz and Fawaz. Okay, now by so Fawaz Ashraf, he has some of the devices that have been made using some of those things that you have mentioned. You know, it is the chemicals and the number of amount of serotonin and various hormones to identify and how to improve it. And using this system, people will become younger. And I like what you say.
Dr. Kavi, in fact, this is exactly precisely my question was when I asked about the diagnostic methodology, because this Fawaz, he takes all the 4 samples, blood, urine, stool, and saliva, and based on that, he performs 7 different tests and prepares the report with the state as of today and what it should be if certain corrective and preventive measures are being taken. So that was my precise question. How do you proceed in your endeavor?
Yeah, it's a very interesting question. So, now what you have mentioned is the diagnostics aspect of it from markers, whether it's a genetic marker or a hormonal
marker, or chemical marker,
or a biochemical marker. This is,
Yeah.
but why a person having this by birth? That is the puzzle we solved. Okay.
They have
So what is-
gone. Yeah, shall I explain as I understand? See it correct or not? They have actually, you have developed how this is happening, and you are trying to catch
Exactly.
it before it happens.
Exactly,
So
exactly. At
we
the atomic level.
even can identify people who are likely to have during the pregnancy, and we can deal with them.
Exactly, exactly.
Understood,
Very
Brother
much.
Saqib?
Yes, I got it.
I think Kavi is in ahead of what they are doing right now. They are taking the older people and dealing with them, correcting some of the things based on the similar principle. But Kavi is more than that. Kavi has done research into how those develop during the years. Why
Dr.
do people
Mahroof,
age?
Dr.
Even
Mahroof,
during
as you know, that
the pregnancy,
our
sir.
Huh?
Dr. Mahroof, as you know, that our life care journey starts when the cell fertilizes and the first germ cell bonds. And
That's why
from
we are
there
here.
on, we
Because
monitor.
we are
And then
monitoring.
we go all the way. That's it.
No,
All
in
the
my
way. Yes, sir.
presentation, just to explain that, Kavi, to you, I
Yes,
have
sir.
a presentation called The Journey of the Unborn Baby.
Oh, okay.
From one cell
Okay.
to the 600 billion cells when it is born as a baby, a
Okay.
newborn baby. And that journey I have described, and in that, you're giving me material to put in.
Exactly, sir.
Precisely. That's the life
it
care.
took 30 years for me to crack this.
I know, because it will be very useful when we fit this
Very
in.
useful, sir.
You
will be
and
very
you and we are just like two sides of a cup, you know. Do you understand? Or
Doctor,
of a
Yes, sir.
ball. So I
Doc-
think
Dr. Kavi, in
Yes.
theory, our ambition is that the moment physical birth or conception has taken place, we do it virtually. The physical goes by the environment, but the virtual goes by the rules and regulation. And all the time, we compare the way we do it in ICU, the heart stabilization, right? So that is what in theory we are aiming at when we say life care project.
Yes,
this is
sir.
why we
What
called
is
it.
the question? What is the question, sir?
There is no question. I'm
Then the
just
question
telling
is
you
commenting.
what we are going to achieve.
He's talking about universal life care, what it means.
Yeah.
Universal life care, it is applied universally, not only
Yes.
to humans, but also
Yes.
to other animals and also to
Exactly.
plants. And reverse, we learn from the plants and the animals and feed it into humans. Because there are some
Yes.
things that the plants and the animals doing. I mean, the leaf, if you look at a tree, you can't say it is an old tree. It is the same leaf.
Yeah,
When
same leaf.
how does it keep it? And this, you are having the answer with you. So we can fit all these things in and we will form into a group, I mean, for the health of humanity. For humanity, we are doing this service. It's more
Yeah.
than to say that we did this, we did this, we did this. No, it is we are trying our best to understand and apply and get people to follow so that there will be a time when people live up to 100 just like they live up to 30.
Definitely,
So
sir. Definitely.
So they live longer, they live healthier, they live younger, right?
We used to live longer, sir. People used to get married at the age of 60 in India, and women also used to give birth to children up to 60s. Now the situation is completely different.
Different, yeah, I
So
know.
we lost many things.
Yeah.
We lost.
But this is, Dr. Kavi, this is still in Baltistan, up in Himalayas. It's still the same lifestyle.
Now you joined hands with us. We are
Yes.
going to live.
Yes, of course. Of course.
Yeah, because
that is what the
comes to
dream is. That's the
anti-aging
dream.
and longevity. When you talk anti-aging and longevity to anybody, first they will look at our face and see whether there is any symptom of that.
And that is
Okay.
Dr. Mahroof is the living example. He's
Yeah. Now
85.
we have to bring him 15 years younger, then make him roam in the market.
Yes, he's
That is
85
the
right
best
now.
marketing we can do.
He's 85 right now, but you can't say he's 85.
I am
Okay.
83, man. Come on.
Anyway.
Don't increase 2 years.
Every time he increases 2 years, doctor.
So is Nawab Saab.
Yeah.
I did little tricks with him, my tricks with him.
Ah.
Now he has become little younger. Yeah, he knows very well.
Yes. I'm waiting for the second dose.
Yeah, definitely.
The new Mr. Nawab.
Yeah.
Yes.
Hopefully.
Transformed. Yeah.
Yes. We need to take these things forward, So doctor, our stuff is supplementary. Our what we do is supplementary medicines that we are giving, supplementary food.
No, don't
Right,
call
doctor?
it medicines. I don't think
No.
I
It
ever
is not
call.
medicine. It is not medicine.
Many people say we have a medical facility, we have a medical center, and I call it life care center, life care facility.
Yeah.
Yes, yes.
So
We
That's precise.
concentrate. One thing we must all agree that this is about life, understanding life and how it goes and how to keep it going and remain in without aging. So-called aging is a deterioration of the reconstructive process that happens every night. So,
Yes.
I mean, this is why we need to take our vitamin D and vitamin E in the night, just before you start this. And so the idea is, how do we fit things of our life into situations which will be favorable for regeneration? Allah gave us the 8 hours of sleep to regenerate yourself of what you wasted during the working time. And we know what goes off during working time. We regenerate it, and to regenerate what you need. So I used to take vitamin C in the night. Now I don't. Because
Now,
after
now,
knowing some of the facts, and
now-
after knowing more of what Kavi is going to tell me, I'll change my way of life.
That's right.
Become
Now,
even younger.
Dr. Mahroof, just to recap what Nawab Sahab was saying and what you're saying, this is altogether new terms that we have to speak.
Exactly.
Instead of health, or medical, we have to say life care.
No,
Instead
health
of
is okay. Health is a target. That's okay. That we can keep it. But not health care.
that's
We
right.
can't give
So it's a
care
life
of the
care.
health. No,
Yes.
health is a target.
Yeah.
But what you are giving is a care of the life.
Yeah.
And the life itself is defined by the 250 types of cells, not one type of cell. It was a single cell that made either ectoderm, endoderm, mesoderm, and they developed into 3 main layers. And then they begin to develop another 250 types of cells, doing their function perfectly. But it doesn't do so perfectly under certain environment. This is what you are studying. What is the environment that will keep them perfectly doing their best? And here, yes, a good example is Olympics, where people do their training in such a way, certain muscles, certain things are very well maintained, and therefore they remain young and active. And they win all the races. So I think we are getting some formulas which we need to understand. So the words are very important, as you say. It is life care, and it is universal, and the limits are. Now, if you look at the actual numbers I gave you earlier, a cell can live up to 10 years. A cell. Okay? If it lives up to 10 years and regenerates for 22 times, it's 220 years.
Yeah.
And now they have also found that the telomeres can also be.
You are frozen.
The cell is frozen.
Yeah. Sure.
No. Human cell can actually multiply and make 22 to 30. Now that is 300. 300 years we are talking about. If it is 300 years, it is documented somewhere. Ayah number 25 in Surah Al-Kahf.
Yeah.
Allah has sent the
The
message.
seven sleepers as per Bible. Now,
Yes.
And the other word is medicine must be replaced with the supplement.
No, medicine must be, it is, medicine cannot be replaced because medicine is a medicine.
No. In our case,
No, people are using medicine in the wrong terms. What we are talking about, life without medicine is well-being, feeling well.
Yeah.
So it's mind, body, and soul.
MBS.
MBS.
Yes.
People
Mind, body, and soul. Not Muhammad bin Salman.
We must tell him that.
Yes,
I will
of
tell
course.
him.
Yes, of course.
Mind, body, and soul.
Yes.
So I think we are a good group. I feel Kaviarasu, Balasubramaniam. Now, I told them what is the meaning of Kaviarasu.
Yes.
In fact, I told them Kavi, poetry, and the king of poetry.
Yeah, exactly, sir. Yeah, that's what.
But
So, Mr. King, now you are.
Bala is a young, So young Subramaniam. Subramaniam is a god who.
Balakrishnan, sir.
Balakrishnan, sorry. I'm Balakrishnan. So Krishna is also a god. But anyway, basically, you are the youth of God himself. God is ever living, as we believe it. Right? So here you are. Your name itself is coined under your features of what you're doing.
We call it, in Urdu, we call it Isme Ba Musamma. That the name says it all. Name says it all. Isme ba musamma. So you are what your name is. Anyway, let's
Anyway,
proceed further.
I think, is there
Next level.
any of your information that you can share with us, or?
Yes, sir. We can able to share the product portfolio and what it does.
Exactly.
And we can share our license, FSSI license, food license. We got it from India.
Okay.
So this will probably help you to take things forward, sir.
Yeah, what I can do here is I can use this, I can make presentations, I can get you to supplement it, and then together we can go and present to the Ministry of Health, because I have influence. See, the minister, I gave a lecture about future doctor, and who attended the meeting? The Minister of Health.
Okay.
And at the end of it, he came to me and said, I want you to be in the technology group of the ministry.
Okay.
So I'm a member of the technology group, and also I'm a member of the nursing group, and also a member of the training school. I'm in training department division of the ministry.
Okay.
So in other words, we can train people for Hajj healthcare. You and I can redevelop this book together.
Okay.
I will give you a copy of this electronically, and then we can redevelop the book, put some of the elements of your based on what you send me, then we can sit together on Zoom and go through it, and then we'll update it, we'll publish it.
Okay. I am
Publish
honored, sir.
things that people can do and when they are coming for Umrah, but it is not only for Umrah, it is a life.
Okay. Yeah,
Okay? If we can
it's a
agree on
great
that,
idea.
whatever financial, material benefit that we have, the one that we'll gain is the grace of God, because we are working for the humanity, not for money, not for getting a new car or something like that. No. So let's do that.
Yes, definitely. Definitely.
Now, kindly, I have created a WhatsApp group. So please share in that WhatsApp
What is the
group.
name of the WhatsApp group?
That is same autism. ADHD.
No, don't put autism as a head of our.
Okay, you please change the name.
That's very simple. Okay.
Yeah.
Lifecare from birth onwards. Okay. So he is looking into even before birth.
A newborn.
So
yeah.
Lifecare from birth onwards.
Pre-birth. Yes. Yes.
Okay.
Yeah.
I call it conception to realization.
Okay. Lifecare from conception. Okay.
Conception to realization. When you realize only, you'll realize Lifecare is useful. And that, brother, I call you brother anymore. We are all brothers anyway. Kavi, I call you brother because
please,
we are
most welcome.
brothers in this group of developing from the conception. Conception happens only by the sperm and ovum coming together.
Yes, that's right.
And after that, the 400 million rest of the sperms are useless. Only one sperm makes it to the
make it happen. Yeah. Okay. I will rename the group and please share everything in your group.
Lifecare from conception
to realization.
To realization.
I will abbreviate it.
That will be. You like it, brother Kavi?
Yes, sir. Yes, sir.
Yeah,
yes,
okay.
Sir.
We'll form that group.
Yeah, we form the group, sir.
Anything else, Nawab Saab?
Yeah, regarding the documentations and other things, because product registrations and other things, because we faced problems here in Bahrain. So now we have come up with a new concept, which Dr. Kavi will explain to you. So, that Dr. Kavi, if you can just tell that, because we need to get this product registered in SFDA, So,
sir, these products, we have engineered these products in such a way that they are declared as supplements, nano supplements.
Okay.
But even there is no directive as of today in the globe for nano supplements. We are introducing a new concept. It will take its own time. So we will introduce as supplements. The entire thing we will introduce as supplements, and
I can introduce the word supplements, including nano supplements. So it is main word is supplements. So they will understand that. including nano supplements means the newly realized information on nanoparticles, and
Okay.
and that's why I once you get to send you a documents that you have there which are of relevance, okay,
Okay.
and then I will develop it and we'll develop it together. It's not a problem.
Okay. Sir,
I will
this
not share it with
I
anyone.
will,
This is a promise to you, because I know there are certain sensitive areas in development of patents and things like that. But we will definitely be open-minded in terms of our closeness. Okay? So you have to
fine,
trust
sir.
us. And, yeah.
We will send you I will send you an basic information, whatever we have with
If you have
you.
applied before, if I applied before, give me that. So I'll get to the person in the Ministry of Health who can, I can modify it with him so that it can be approved.
Sir, actually, these supplements are nano in nature.
Yes.
But in India, there is no guidelines for nano supplements at all. So we
Okay.
declare as supplements. If you can declare it as nano supplements in Saudi Arabia, it's a great thing for us.
No,
Okay,
this
because
is what I am
we
going to
can
do.
make
Yeah.
decisions.
Listen, Kavi, I will
Yes, sir.
take it in such a way. I'll
Okay.
hide the nano inside the supplements. Is that all right?
Okay. Yes,
I
sir.
will do that.
I will send you the documents. You go through it, you will get an idea. Then we can have another round of discussion, sir.
Definitely. In about
So
1
that
or
we
2
have
days, we can have
material to
another
go
meeting.
through, and you will have a better understanding about what we are doing. From there, we can take it forward, sir. Okay.
Exactly.
Okay. Wonderful, sir.
Thanks for coming, and it's a very
Thank you.
interesting.
Thank you for everything, and especially the book which you spoke about, to be an author with you.
Yes.
It's a great honor.
Yeah.
So
It
I
is a
will
great
once.
honor to publish it with you. I haven't.
Okay.
I'm into publication, but still it is in the type form, and
Okay.
So let's work
So
on
once
that.
this conversation is over, then I will share this informations with you in the
Sure.
group.
And sometime in the near future, I will visit
Okay.
you. I will come and visit you. It's not a problem.
Yeah, most welcome, sir. Most
Tamil
welcome.
Nadu. My
Always.
closest friend in Tamil Nadu is A.R. Rahman.
Oh, okay.
He's my close friend.
Wonderful, sir. Most welcome, sir. Always.
Okay.
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 Thank you, everyone.
Very much for sparing your time today. And I think we are beginning to form into something productive.
Definitely, towards the benefit of the humanity.
यूज करना होता है फ्रिज में रखा करें रेसिपी पता ही नहीं
So it's body, mind, body, and soul.
Yes,
Yes,
mind, body,
MBS.
MBS. The MBS project.
Yeah. MBS project for MBS.
When you discuss on public, be careful. You have to be, every letter and half of a letter has to be measured.
Fine, sir.
Okay.
Yes.
Yeah.
Thank
Thank
you.
you.
Thank you all
Have a
for
wonderful
coming.
evening for your time.
Wonderful evening
Saqib,
to all
you
of you.
didn't get your picture because
You're welcome. I
your
have done.
picture is not there. You have to put the picture next time, otherwise you will be banned from this.
I will do that.
Yeah, okay.
I will do that. I have put Dr. Mahroof. I have changed the name, Lifecare, from conception to realization.
No, this group.
Yes, I have
you put
changed
another name for this group. Okay.
I have changed the name of the group.
All right.
Wonderful,
Lifecare
sir.
from conception to realization.
Okay.
Wonderful, sir.
Yeah.
Thanks a lot.
Oh, thanks a lot. Thank you, everyone. Have a nice evening. Bye.
Bye.
Night.
Good night.
Nice
Salaam
meeting,
alaikum.
Dr. Kavi. Thank you very much, Nawab Saab. God bless you.
Thank you, Nawab Saab.
Yeah,
Nawab
we have
Saab
to
is
go a long way.
our example of youth.
Yes.
The young man forever.
Yes.
YMF.
Yes.
Young man forever. YMF.
Yes. Muhammad Aslam Nawab. And
Muhammad
he's going.
Aslam Nawab.
Yes.
YMF.
Yes, and he's going through again another transformation by Dr. Kavi.
So, Dr. Kavi has left.
Yes, I think so.
Yeah, Kavi has left, yes. He's busy man. You don't realize it, although seems relaxed.
He Yes, to get started again tomorrow morning. It's almost 12 o'clock there in
That's
India.
right. That's why.
Anything, Nawab Saab, you wanted to say?
I wanted to say regarding the registrations and other things, we have got to be very, very careful because we did face certain kind of problems here in registering with national health regulatory authorities here in
No,
Bangalore.
that's why I wanted him to send that thing.
Yeah.
Muthukumar has just arrived.
Because what happens,
Wait, don't go away. Don't go away.
the person who is doing all the product registrations, medical equipment registrations,
Brother
pharmacy.
Nawab, I will
Yes, sir.
deal with that, and I once the documents come, I will deal
Yeah.
with that.
That would be
Dr.
great.
Mahroof, Nawab
Yes.
Saab was introducing another very good, effective contact regarding product registration in Riyadh. So that is what.
Who is the person?
Yes.
Dr. Samira, she has been doing registrations for SFDA products, be it medical equipment, be it pharmaceutical items.
Wait a minute. Welcome, Muthukumar.
Hello,
Muthukumar
sir.
sir.
Good evening.
என்ன சரியான லேட்டா வந்தீங்க கவி போயிட்டாரு
Okay.
we had a meeting for nearly I was calling you also now 1 hour and 13 minutes.
Okay. I just finished my
Anyway,
clinic.
we
I'm
have
sorry.
another meeting. I will briefly explain to you later
Yeah.
without what happened, and
Okay.
we'll next meeting you can be there from the beginning itself, because in fairness to you, you were busy, and I had to come and tell you because this meeting was hurriedly arranged today. So that's why I came to tell you.
Okay.
And then I came back and I had to start the meeting at 8:30 because in India it is late. His name is
Yeah.
Kaviarasu Balasubramaniam.
Yeah.
Right. Hello, sir.
Yeah, சொல்லுங்க.
Right. நான் அப்புறமா பார்க்கறேன்.
Okay. பாருங்களா?
Right. இல்ல.
நாளைக்கு
இன்னும் கீழ
சந்திப்போம்.
ஒரு பேஷண்ட் எக்ஸ்ரேக்கு விட்டுருக்கேன். நான் போய் பார்க்கணும்.
அது போய் பாருங்க அப்ப.
Okay, right.
Okay.
Okay,
Thanks
bye.
for coming. Thanks for coming. Next meeting I'll tell you when it is, and you better come from the beginning because this is a real interesting project. And it is based in Tamil Nadu.
Okay, sure.
It is based in Tamil Nadu.
Very good. Okay.
Okay. Take care.
Right.
And then I have a patient I have to show you. He is a friend of that Professor Sharif, and he's Baksh.
Mhm.
He's a senior Baksh, the owner of Baksh.
Okay.
And he has some problem with his knee.
Sure.
Sorry,
No problem.
not the knee. He has a problem with his L345, he said. And I said, I will talk to you and get an appointment for him. In the meantime, I have a problem, developed a problem yesterday while getting out from the... Huh? சொல்லுங்க என்ன?
Okay.
And I also have a minor problem.
No
on
problem.
my
Tomorrow,
knee.
Friday, any day.
Okay, we'll try to meet tomorrow.
Fine. Let's meet tomorrow. Yeah. Sure.
Okay, take care. Thanks for coming. Better late than ever. I was pleased.
Yes.
But you'll be very pleased to meet Kavi.
Right, sir.
Kavi is a very fantastic guy.
Excellent.
Okay, sir.
Very good. It'll be my pleasure. Next meeting,
Okay.
I'll join you early. Right.
Yeah, okay. Certainly. Okay, Saqib, bye.
No. Nawab Saab was saying something about Dr. Samira.
Yes. I need to get Dr. Samira's telephone number. Where do I write it down?
Yes, Nawab Saab, please go ahead.
Yes.
Go ahead, please.
I'll just check the number.
You can tell her and I can talk to her and we can plan to write up this thing with Kavi. Samira, what?
One second.
Lifecare from birth to No, conception to realization, huh?
Yeah.
Conception to realization. Okay.
Realization or end of life.
Huh?
Anyway.
It is Dr. Samira Mohiddin.
Muhyiddin.
Moyuddin. Moyuddin.
M-O-O.
Moeed.
Wait.
Mohiddin.
M-O?
M-O-O-I-E-E-N.
Yeah. D.
D for Damam.
Deen. Moiduddin.
Muhyiddin. You know, this is Muhyiddin is the correct Arabic name.
But this is Moeed.
No,
Yes.
it doesn't matter. It is not Mohi or anything. Muhyiddin, Muhi mean is covering.
No,
The
Dr.
one who is
Mahroof,
covering
it's
the whole
Moeed.
of the deen.
It is Moeed, not Mohai.
Not Mu'id. It is not Mu'id. It is Mu'iddin. There is no Mu'i in Arabic.
No in. Eid. The.
Huh?
Moeed.
Mu'id.
Yes.
Mu'id.
This is an Arabic word.
No, cannot be Mu'id. Mu'id is the correct word, but
Yes.
Mu'iduddin.
Yes, this is the name they have kept it.
Mu'iduddin. No, it is not. It's Mu'iddin.
You are getting confused. I'm sorry. It is M-O-O-I-D-E-N.
Yes. Yeah. That is Mu'iddin.
Yes, that's Mohiddin.
Not Mu'iduddin.
Nobody said Mohiddin.
He is saying it. He is saying
Moeddin.
Mu'iddin.
Moeddin. Yeah.
Muhyiddin, that is because it is slang. What has happened, it is become slang because the people do not spell the Arabic. How do you spell this in Arabic, Muhyiddin?
Mim, Ain, Ye, Dal, Ye, Noon.
There is no word.
Anyway. In Bangalore, you will come across many names.
No, it doesn't matter. I'm telling you what is the base. I know it because it's my name as well. So that is why I researched into it. The one that is Muhyiddin is Muhi is in Arabic. Muhi is covering a whole large area, the whole of it, covering the whole thing of Deen. And who covers the whole of the Deen? Allah. The cover of the whole based on it. Anyway, it doesn't matter. This is what I know, because maybe you have another word which is different than M-O-H-I. Mim, ha, ya.
That is Mohiddin.
Muhyiddin, you go and check in the Quran. It is there.
Yeah.
Muhyiddin is there.
Anyway, note the spellings and that's it. Finish.
Yeah, I have got the spelling. That is important.
Finish. It's a name.
People are attached to their own spellings.
Yes.
But the spellings, unfortunately, even my name is Mahroof, which is M-Ain-Ra-Wa.
Yeah,
He has written Mahroof.
Yes.
M-A-H-A-L-R-O-F.
Yes, that's it. This is what.
That's a complete distortion of my name.
Of course. And the whole Sri Lanka, the whole Bangalore, every day.
They keep on changing words and letters.
Yes, of
and,
course. Sounds.
The
Anyway,
actual word is in Arabic.
That's the lighter part of it. Let's continue.
Okay, brother. So I got this, Samira. What is the number? You didn't give me.
Because we were trying to set her right, her name.
We are trying to muhi the whole thing.
It is 53.
053.
053 685
685
2066.
2066.
Yeah.
So what is the position?
She is working. She does all the registrations of all SFDA products, medical equipments, pharmaceutical products.
Ministry, or she's working in the ministry?
She doesn't work for the ministry. She has her own company. She is working with the Pakistani, who is there, who is a Pakistani Saudi. And they do they help all the medical companies and
which
hospitals and
want to
pharmaceutical
register.
companies.
So we will have to find out what are the requirements. And when we set up our registration document for this,
Yes.
the project on the conception to realization, okay? And then we will put it in according to what she requires, yeah? And then she will get it passed, and then it can be the project that is registered throughout.
Yes, I will call her tomorrow. I'll tell her that that you will be calling her.
Yes. Then we can
Then
have
we can.
if you want, we can eventually arrange a Zoom meeting and have a Zoom meeting with
No,
you and
that
Saqib
you
by
can handle it directly. Yeah, that you can handle it directly with her, because
Yeah,
let Kavi send all these documents.
yeah.
Because not only this, we will be requiring their support for registering the HOCAT, that is the equipments that are going into our wellness center,
What
which
is
we are
the
planning.
what is the what is the wellness center?
HOCAT.
Huh?
HOCAT,
HO.
HOCAT.
Who is doing that?
We
Dr.
are doing that.
Mahroof.
Huh?
We are all doing
Dr.
it together.
Mahroof is doing that.
No, Dr. Mahroof and who?
Dr. Nawab.
All of us.
Nawaf and
Nawab Saab.
Now let me
No.
come to that. See, we are planning to establish an alternative medical center along with wellness center there in Jeddah. That's what we discussed when you were here in Bahrain.
Correct. But the HOCAT is who's
HOCAT is an equipment which does 10 different detoxification.
this is the HOCAT equipment, the name of the equipment.
That's a medical equipment. Which is
HOCATT, is it?
yes. All of these details.
No, wait, Nawab Bhai. The spelling is HOCATT.
Yes. I will send you all the details. I will send
Send me
you,
the details. Okay.
because let us go quickly through what we are planning. There has been a mail sent across to Javed Bhai from India regarding the complete project report with ROI and everything that will be worked out, the equipments that will be there, the requirements of space and everything, the complete project report, the cost with financials obligations that need to come in from
That is
an
Saqib Bhai, is
investor.
that the one that you sent this afternoon?
No. He is going to send it separately.
Okay.
Yeah.
But give them titles so that we identify what they are. We shouldn't mix it up. For example,
No, I will.
Yeah, the
You will.
project of brother Fawad
No,
has to be separate, and brother Kavi has to be separate. Now we have the HOCAT, which is whoever
No,
is the originator.
HOCAT is one equipment. There are nearly about 8-10 different equipments that go into this place.
Yeah,
And each,
excuse me, shall we put it under the Lifecare group? We can't. We have to put
yeah, it is
another group.
it is a center that we are going to establish, right?
Yeah.
there is a holistic group already for that.
Yeah, we can put it under holistic group.
It is, and it is that. This is from the day one that we are going to put a wellness
The group
center
of
in
holistic
Jeddah.
group will deal with all alternative medicines that have been alternative life care that is being introduced in the world.
Yes,
Okay.
but starting from Jeddah.
Starting from Jeddah, yes, I am
Yes.
telling you. But the one that is of this chap, we'll have to keep it as a separate one,
Of
because
course.
Which one?
care from conception to journey from conception to.
See,
Okay.
that comes, listen to me. I'm sorry. I'll come in here. The concept is, when we are having this, initially we may not get the permission. We need to have a Siddha specialist working in our center there, where we have to have a separate room allocated for that, which we can do it as telemedicine.
Okay.
Okay, we are going to collect the patient's data. There are forms that are available where the patient needs to fill this for autistic autistic children, for ADHD, for cerebral palsy, and other things. And that is sent to across to Dr. Kavi in India, where their team analyzes the whole details, and then they have prescription for the supplements that go into that
Each of
for
those.
that patient.
Yeah, that's fine. Because that is, once he sends the document,
So
I'll go through that,
it's
and I'll also ask for the forms, and then we will submit it to Samira. Okay? So I want to know, the HOCAT doesn't...
form has nothing to do with that.
And you brought another person. What
See,
is the name?
please let us.
Dr. Mahroof, you have confused it. That Samira is separate for a registration.
I know. I'm not confused.
So don't bring Samira right now. Let
No.
Dr. Nawab Saab complete about this this project, particular project. Yeah.
What project?
Wellness Center and alternate medicine in Jeddah.
Wellness Center and?
Alternative medicine center, which
What is
from
it?
the day one we are talking since Bahrain that we have to establish a center.
I told you that there are thousands of people from the Gulf region, from Saudi going to Bangalore to take treatments on colon hydrotherapy, on EECP for external counter pulsation for the heart, regeneration of the heart.
Make the list of it, brother. Make a list of it. And now, do we put now the one that is of the Kavi is going to be called by the name that he gave us, isn't it?
That is an integral part of the whole setup. What we are planning to set this up in in Jeddah is inclusive of this one small clinic, which is going to be for this. All the research work and all other things, you can do it from your office. What treatments are going to be performed are going to be from this place where we are going to hire
I
a
agree.
place.
I agree with that totally, because discussion will be based on the so-called group that we have put, two groups. One is holistic, the other one is life care from conception to realization, whatever it is, yeah. And then when we bring in additional things, we must know under which title in this center. So we will have one center called Wellness Center. Is that right?
Yes, that is the center. And then if things go well, then we could replicate these centers in Riyadh, in
No, but that's a
Khobar, in
different
other
thing. No.
places. In
I'm
Arab.
talking about the name of
That's
the center. We call it Lifecare Wellness Center. Correct?
Lifecare Wellness Center.
Is that all right?
Yes.
Brother Saqib.
Agreed.
Okay. So Lifecare Wellness Center is the main center, under which various forms of therapy. One of them is, of course, Kavi's thing, yeah?
That's right. There are 10 different therapies which will happen.
No. Yeah, wait a minute. It is not talking about therapy. It is talking about area of work.
Yeah.
Depending on, now, therapies can be listed out in hundreds, not 10, 20, 30, no problem. But we must group them into, for example, this is where holistic is one of them. Okay?
Yeah.
Holistic is one of them. And the other one is nano and, the technology of...
Quantum. Nano and quantum.
Nano and quantum, yeah. And the third one is where we put the go-kart and other things, So we'll put what we are having is the main group is Universal Life Care. And under this, we put a Center for Wellness. Correct? Brother Saqib, listen.
Listening very carefully.
Lifecare Wellness Center. In this center, we have all forms of therapy. They are grouped into by the originators.
Yeah.
Is that correct?
Yeah.
Saqib Bhai. I mean, Nawab Bhai.
Yes, sir.
He's gone silent.
See, No, the thing is, we are establishing a healthcare, whether you name it as healthcare or wellness center, life care wellness center, that is one which is having facilities. Like in India, when these people see this from Saudis, the Kuwaitis, the Bahrainis, all of these people, they say that yes, we are going for ECP for our heart. This one, we are going in for colonic cleansing. We are going into India. We are going in for pain clinics, for
Brother Nawaz,
syndromes.
give me a list of it, all the
Doctor,
full
yeah.
comprehensive list of it,
Doc,
then we can fit it in.
That
Dr. Mahroof,
Saqib Bhai
Nawab Saab is giving
Saqib,
a complete document of the project, Wellness Center project, complete document.
Where is
Complete.
it?
It's coming. It's coming.
It's not come. Okay.
No, it's not come. It's coming.
Okay.
yeah, because that has to be systematically arranged. That has to be systematically arranged. The first thing is to make the project report. And what is the, the area, Jeddah? We are going to start with Jeddah. Who are going to be our clients? How many patients are there? What is the demography of Jeddah and all the surrounding places where we can get patients in? All of the details will be worked out. Then we are going to see these are the equipments that are going into this particular place. What is the cost of the equipments? What is the charges that you are going to charge to the patients that come in to avail the treatments? All of these details are going to be worked out systematically, product by product, and everything is going to be made available. So that once you know that
Who is going to
Let me-
supply those things?
I will tell you something, sir. Please let me continue.
Yeah,
So,
okay.
the total cost of the equipment, what is going to be the cost of this? Whether this product is registered or no. No, if this product is not registered, we can take it under our head and say that, yes, we are the distributors for this. So we have an arrangement with the manufacturer that this product is being distributed by us. And this product goes to Samira to get it registered. We have to register this product to bring it into the country.
Done.
Yes, SFDA registration has to be done. So that product gets registered. Because tomorrow, if somebody else wants to buy this product, we can sell it because then we become the sole distributor for this in the Kingdom of
Exactly.
Saudi
This is
Arabia.
what I am trying to
Nobody
tell
else
you.
can bring.
We have to register
Yes.
our names and the
Yes.
modalities of treatment that we are providing under our name, so that anybody who wants to use it or elsewhere, they have to take our permission and do it.
They cannot order and bring this equipment from outside if it
That's
is
right.
registered under our. So if they want to buy this, they have to go through us so that we sell it to them with our percentage of profits on that.
Exactly. That's what Fawaz said. Fawaz is going to take
Okay.
all the things through us.
No, that is a patient.
Yeah. Fawaz
is a patient.
Fawaz is a small entity in this, it is
That's
just
right.
one particular thing that is he will do testing and analysis and that. Here we are speaking about 8 to 10 different brands of products. Okay, we are having ozone machines, we are having your Invet for lightweight, for lightweight, what they say, nanotechnology that we are using for treating tennis elbows, frozen shoulders, carpal tunnel syndromes. There are different applications. You can even break kidney stones with this particular soft laser that we are going to get in from Ukraine. So we are going to take this. I'm the distributor for Pan Asia for these soft lasers. For Saudi Arabia, we can have our company's name, which we are launching now under the new brand that we are going to create. And this product is going to be registered. This can be sold to every house in Saudi Arabia.
Okay. Now, can I
Dr. Mahroof,
Yes.
on Fawaz, it is only for the patients that you are going to refer to him. That's all. Finish. Nothing more, nothing less.
No, brother.
Yeah, we are not
Wait a minute. Wait a minute. Let me make it. I want to make it clear for myself. Now we have the center is a Lifecare Wellness Center.
That's right.
Okay.
Yeah.
And which is registered under Universal Lifecare 360 in the UK.
And Saudi Arabia, of course.
And Saudi Arabia.
Yes.
But if the center is called to be called a center, we need to register that center also under UK.
Yes.
I can
Let's not-
register it.
Whether it is
Right now,
allowed in
let's
Saudi Arabia
talk
or-
Saudi Arabia. Yeah.
Yeah, because Lifecare wellness center, okay? Lifecare wellness center I can register tomorrow. I tell my friend, give him £50 and he'll be registered. So we
Yes,
have a
please do
name.
that. Please do that.
So do that in Saudi Arabia.
And under
First
this,
we start in Saudi
say
Arabia.
we
then
are
they-
the sole agents. No, wait a minute. We are the sole agents for 1, 2, 3, 4, 5, 6, 7, whatever it is.
Yes.
One of them is Fawaz's. He's shaking his head. What is
No,
it?
let,
No.
let me come here and come here and clarify certain things, please, because this agency has to be taken after your registration is done. Then only we can ask for the agency letter from there. There are certain products which there may be an agent already available in Saudi Arabia. We don't know about it.
Yeah, you find out. You find out.
You know, I'm
We
telling
don't.
you. See, I know Hocat will directly give it to us. Directly,
Okay.
we can buy it online. We can buy it online. They will give us all this, and then we can have an agreement that whenever any inquiry comes to from any individuals also that they want to buy this, they have to keep our margin of profits on that.
Okay, I understood that. The thing is, I want to know what are the things that are coming under Lifecare Wellness Center.
Yeah, that's what I'm
Included
saying.
it.
You know,
Yeah.
there are certain agencies which my company in Bahrain holds the rights for the Gulf region.
Yeah.
Okay, like for example, ozone unit from Haberman in Germany. Okay, that is for ozone. Colon hydrotherapy. That is also I am distributor. I can very well tell them that we have a branch in Saudi Arabia under the name of this. So the agency for Saudi Arabia can be passed on to this company.
Okay. That's what I want to
Okay,
know.
so that makes it much. That's what I'm saying. You know.
No, that you are saying for certain things we'll be sub-agents. For certain things we'll be main agents, correct?
Yes. That's what I'm saying.
So
For
you
for
must
Saudi
know
market,
of the things that we are taking, which are the main agency we are taking, which are the sub-agency we are taking.
Dr. Mahroof, this
Yes.
is what Dr. Nawab Saab is going to put up the proposal, complete proposal for
Okay.
Lifecare Wellness Center, and will submit it, right? Covering
Yes.
all the aspects of the feasibility, may it be economic, may it be market, may it be financial, may it be technical, right?
Correct. That is
Everything.
that part of
Yeah.
it is different.
And
That
may
is
it be operational, all the 5 areas.
okay.
Yeah.
See, because tomorrow when we have the equipments installed, like for example, the ozone machine installed in Saudi Arabia, I will bring the team from Germany. They will come. They will train the people in Saudi Arabia.
Okay.
Then to operate this, we have got doctors in India who can be hired and they will run the center because they have been treating these patients from the Gulf region for the last 8, 10 years, 15 years, 20 years. So we can get those people who can operate this place. They see this is all. Once things get into place, then all these things will fall into order. Everything will be
So that's
clearly
it, telemedicine.
highlighted.
Yeah.
Yes.
Okay. That is why I'm
So
saying.
let the proposal come and then we will talk.
Exactly.
Yes, please. Yeah.
Fine. But now it is Fawaz Bhai will send us a list of the things that will come
Nawab
under
Sahab.
Lifecare.
Yes.
No, yeah.
Yeah. Not
I'm
Fawaz.
Now, yeah, I was getting confused where Fawaz is coming in again.
No,
not
Fawaz.
Fawaz, no, Nawab Sahib.
Nawab.
You can call me Aslam, no problem.
That's better.
Aslam is the best thing.
Aslam is the best thing.
There is no confusion between Aslam and anybody else.
That's right.
Yes.
Aslam is Aslam.
Nawaz and Nawab is Fawaz
very,
and
very,
Nawab are very
It's a slippery road.
Pawa, Nawa.
Yeah. It's a
Okay.
slippery road. Yeah.
So let us go systematically. See, I'll tell you, the return on investment for these particular products that we are introducing in Jeddah, if we do one center, believe it or not, we can have almost about in Jeddah only, because we have to have for the ladies separate, gents separate. One machine cannot do for both the male and female. They have to have a separate section where they are getting these treatments done. So once the approval from Saqib Bhai and you are through, then we can proceed with this. And within 8-10 days, all documents, I can ask them to prepare most of the documents, send it across with return on investments, what is going to be the costings, because then you also need to be talking to the investors that who are going to come into
No,
play
I
in.
need it now because I am talking to the investors from tomorrow.
Yeah,
So,
but the thing
Nawab
is,
Saab, you get our go ahead. Please go ahead.
well, see, I cannot go ahead because this is not done by me. It is done by the team back home,
Okay.
And that the email is already with you in your email box inbox mein. Just please go through that,
Whose
go
email
through
is
it,
that?
read it, because that makes the project serious. How serious we are, then we move forward on that.
Where is the
Okay.
So
email?
let us be professionals.
Wait,
Let us be
where is the email?
professionals of all of this. Yeah,
Where is
it is
the
already
email?
been sent by
Aslam,
the
who has
has
the
been
email?
sent from India. Saqib Bhai, on his Saqib Bhai's email,
Okay.
this one has the
I
details
didn't
have
have
been
it.
sent.
I didn't have it. You have to send it to me as
Yeah,
well.
he will forward it to you.
I will.
He will
I will. I
forward
will.
it to you.
I will do that. But let me just see where
Aslam,
this
anything
email
you
has
send
come
to
from.
Saqib Bhai, send a copy to me so that I'm aware.
I'm not the one
Yes.
who generated the
This
email.
is
It is
Zaifura. This is
yeah,
Zaifura. And
Saifura. Yeah.
yes, I'm just forwarding it to Dr. Mahroof.
Okay. All of them will go under the project Lifecare Wellness Center. Okay?
Yes.
Yes.
Fine.
Yes.
So
Dr. Mahroof?
any email you send, Lifecare Wellness Center, and then you send the subject, it's okay. We can fit it in.
It is, I'm sending it to Gmail, your Gmail account.
My Gmail account and
your
title of that will be Lifecare Wellness Center.
and
Under
that is
that, you put
Dr.
all the divisions, everything, it will come.
And also maroofdoctors.org.uk.
No, don't do that.
Okay. And Mahroof.
That is doctors.org.uk.
Okay. And
don't
iDoc.
only Gmail. Only Gmail, because I don't want it to be distributed.
Okay. That's fine. Taken.
So it's easier, so I won't miss it. That's the main thing. Gmail, I see them every day.
So the subject is Lifecare Wellness Center. Okay.
Right. LWC.
Okay, I'll put LWC, capital.
Okay.
LWC dash strategic.
No, what is that?
That is the sub-subject, strategic consulting proposal, right? That has come.
Okay.
Okay.
That
so
is
this
what,
has gone. This has gone to
Aslam.
you. Have a look, please.
Yeah, it will be there. Don't worry about that. I will just
have a look, please.
Okay.
It takes only a moment. So then we will discuss it.
No, I'm looking for. It's here. Oh, this is WhatsApp. You sent a Gmail, huh?
It is on Gmail.
Subject Lale Strategic. What is Lale?
Strategic Consulting Proposal, Wellness and Integrative Therapy Center, Jeddah, Saudi Arabia.
Strategic Consulting Proposal, Wellness and Integrative Therapy Center, Saudi Arabia.
Jeddah, Saudi Arabia. To
What
Mr.
is
Saqib
integrative
Javed,
therapy?
Universal Life Care 360, right?
Wait a minute. You're changing the title.
No title. It is addressed to. Title is done. Finish.
What is the title?
Title is just what I have just read.
Wellness and Integrative Therapy Center. Why integrative?
Okay, they have given it a name. Let's.
Who has given the name?
Who has sent the email?
They have sent it.
Yes.
Wellness and Integrative Therapy Center. Okay. It is
Yeah.
going under Lifecare Wellness Center.
Exactly. Thank you.
Okay.
Thank you.
It is a little confusing for me because of the fact that it is Wellness and Integrative Therapy Center, right?
That can be changed anytime, sir. Whatever
Yeah.
is the
You
that
can
could be
name the
changed.
baby. Yeah.
I want to say Wellness Center and Lifecare. That's all. Two names. Two names which already we have.
Whatever you decide, Dr. Mahroof, we will follow it. Please.
Okay. So
Yeah.
we'll call it, if you don't mind, as we agreed just now. Okay. Lifecare Wellness Center.
That's it. LWC.
Because
Finish.
the integrative means we are
LWC,
integrating
no
all of them into
discussion.
one.
No
you know?
discussion. No discussion. LWC. That's it.
And
Lifecare
please
Wellness
kindly get this registered. Kindly
Yeah,
get this registered from in Saudi Arabia. Okay.
Now I have to, tomorrow I'll register it in the UK and I use the name and register it here.
First do it in Saudi Arabia. UK will follow later on, I think. So
No,
because
the other way
Saudi,
about. They will ask
Yeah.
you have a office like this elsewhere. We have to tell them.
yeah, okay. Because I think in Saudi Arabia you need to give 3 names, out of which they will say, okay, this is okay. So, but with your influence, you can get whatever you want.
No. Like, you see, when we put the Lifecare, it is the main center that we originate in UK is better.
Up
Do
to
you
you,
understand?
Dr. Mahroof. You are the judge. Please.
No, otherwise they will say from where
You
did he
know,
come? And then
you-
they say this place, no, we don't agree. It has happened. Confusion has happened before. That's what I am telling you.
It's
So
a
suppose it is coming
15-minute
from
job
India,
in UK.
then they will say, why not from Pakistan? Somebody will say that. So UK, nobody questions.
Okay. So 15 minutes job in UK, 15 minutes job in Saudi to get it registered. Finish. If the
Okay.
name is available.
That's the next thing we have to find out.
Yeah, I will find it out.
How can you find out in Saudi Arabia?
No. In UK, I'm telling you.
UK, the name is available. Yeah. Okay.
No, it's not. I have to check.
No, there
Company's
won't be a
house.
Lifecare Wellness Center. I can promise
Hello?
you.
Okay.
You can find out.
Yeah, I
Okay.
will find it out.
It is Lifecare Wellness Center. Because I want only 3 names, because anything more, it is confusing to people. Lifecare is one word. Universal Lifecare 360 is one word. We have only 2 words, Universal and Lifecare 360.
Right now, we are talking Lifecare
No, in your
Wellness Center.
Saqib to Saqib Javed, Universal Lifecare 360. 4 names. Because people will creep between spaces. Be careful. It has happened.
Yeah. Go on. Carry on. But
That is why I say smaller number of words and there is no space other than if necessary.
No worries.
Okay. So that's fine. They're excellent. I'm waiting for, now you have sent the email that came to me, right?
Yeah.
From Zyphora.
Yeah.
That's the only one that came.
Dr. Mahroof, Lifecare Wellness Center Limited is not currently registered company in the UK. So it is available.
That's right. That's why I said tomorrow morning I'll do it.
Yes, it is available. Wellness Center Limited is available.
Lifecare Wellness Center.
Yeah.
So Lifecare Wellness Center is available. We'll do it. Yeah. Okay.
But a company with the name of Life Wellness Center Limited is available. Is not available.
Brother,
Is already there.
Don't confuse, please. That's what I said. Be careful when they will creep in between and put some name and then
Okay.
it'll
So
be a confusion.
Lifecare Wellness is available, but Life Wellness is not available.
So we are not putting Life Wellness.
Yes, Lifecare is available.
Lifecare
That-
Wellness Center. Because don't confuse us.
Not confusing. I'm telling you what is company's house telling me.
Yeah,
that
what
they-
we need, what we have planned, is it available or not available?
That's all
It is
I know.
available. Lifecare Wellness
Finish.
Center Limited
Don't
available.
go to investigate. You will find so many loops inside.
Yeah,
It's
but
several
it's
names.
available.
Finish.
Lifecare Wellness is available.
Correct. Tomorrow morning I'll do that.
Yeah.
Okay. And that I have to do soon after I register in UK.
But
I register.
please keep in mind that at times company's house, if finds that there is a very close name available, they may refuse to accept it. Right?
Why are you bringing unnecessary confusions now?
It's not unnecessary confusion. I'm giving you awareness
Awareness of what?
that when we go to incorporate with the name of Lifecare Wellness Center Limited, the company's house may say that this will not be registered because Life Wellness Center Limited is already there.
No.
They will. Anyway, there is
But
Dr.
what do you mean
Mahroof,
they
this
will?
is my
How- I know
domain.
about Lifecare, I know about Life 360, I know about Care 360, all that I have looked at. When I put Lifecare, it is one word. When you put spaces in between,
There is no
people will
space.
creep.
There is no space.
That's why I said only two words. Lifecare is
Okay,
one
I have
word.
heard that. But I'm saying Wellness Center Limited is common between the two, Lifecare and Life. So company's house may object that there is a close name, there is a confusion, so it's not acceptable. Anyway, that I will check tomorrow and confirm it to you.
And let me also come in here, if you don't mind. See, Saudi Arabia, there is no limited. It is not. It is either LLC or WLL.
Yeah. It is LLC. I'm talking UK. UK is limited. There is LLC.
You register it as limited, and
brother,
Saudi Arabia it will be.
Brother, we can go on till another 2 hours with this discussion. No need. We have taken one word, Lifecare Wellness Center. Okay?
That's all. That's all.
That's it.
So these are the things. Once we get started, there are a lot of other things. We could also form, getting into medical business also. We could take up certain agencies where we can sell and make some extra money for the company there in Jeddah.
Sure. You can investigate that and put a list and keep it and send it to me.
Once the ball is kept rolling, then we keep on getting new ideas. What we can do, we can communicate with groups which are making food supplements in India. There's a huge demand for vitamin C's and other things.
That will be very good. Food supplements are real. People like it.
So we can get connected once our company is formed, once everything is in place, then it becomes easier. We get new ideas, we can get new people
Tomorrow
coming.
what I will do, I'll call Abdaziz and just register this Lifecare Wellness Center first. Then I'll go to Sheikh Khalid Meera. I will tell him to register the other name in Saudi Arabia. Yeah. And this is the second thing I will do.
Yeah. And then once you go through the papers that has been shared with you now, and then we can tell them to get started. These people, they said that once everything is in place, even if you want to come and do the complete entire setup of the place, there will be people who will come in, they will stand there and get the whole thing organized, that like we have done for Dubai, for Bangalore, for Bombay, from Ratlam, all these places, they have established this. They are specialized, how to use it, where to use it, and to get the right people coming and working there. So these are all the things. That's if stage number 1, 2, 3, 4. Once we get started, once we have got these things done.
Once we get started, then both of you will be all the time involved in this. So you know what's going on.
Absolutely. Saqib Bhai, we can also look at getting stuff coming in from UK also. There are certain agencies which I can tell because I have got connects there.
Good. Please do that. Yeah.
Because that's how we have
we
to
are only bringing the strings together,
Yes. UK, Mr. Jafar Ali Mirza I was getting most of the stuff for Saudi Arabia from him only. He used to source me parts and other things, medical equipment, spare parts, disposables. He used to buy and we used to get it cheaper than the other places.
Yeah.
Excellent. No, we can, there is no limit. As far as we are concerned, we keep track of what we are doing and then go on expanding it, no problem.
Yeah. Once this company is formed, then we can have our MOU, we can have our business plan, then we can have who is doing what and who is getting what.
Correct.
Right,
Saqib.
Saqib Bhai?
Yes. Thank you very much.
Saqib Bhai, why do you hide your face?
Aslam Sahab. In fact, I was wearing this, I was getting ready for the night. So I'm wearing my gown.
So your gown is not very offensive for me. Aslam Bhai, you have any objection for his gown? Does he show any of his private parts? He's very worried about his gown. Because I am wearing Uttarani girl. No, I just came out from outside.
Anyway.
The other thing is, I think Professor Siddiq is again back. I think this month end he is again making one more show, I suppose.
Brother Siddiq Bhai is a joker, man. Everywhere he goes and says that Brahmam Gastam. What is that thing? Brahmam Gastam. Yeah.
He has gone bonkers. Bonkers.
He doesn't know which direction he is facing.
Aslam Sahab, when is this next show?
This is after 3-4 days, I think so.
He wanted to go to Burkina Faso.
He's gone everywhere and he's coming back. No, he has gone everywhere. He's coming back.
He went to only, what place is this? Rwanda.
After that, he has gone to Guinea.
From there, he's a private secretary to Ibrahim Traore is coming. So I'm going with him and I'm making a thing. But the Faso thing didn't work. So he just quietly subdued it. And you're saying he's coming back to Bahrain. Yeah.
Yeah, and 31, he's asking me, how many people you have? I said, what is the event? Where is the event? Who are the people?
No, but you must ask, what is the objective? What are you going to do?
How much money you can bring, he's asking me.
No, he's asking me to give $5,000.
So
I'm trying to publish the book with your name in it. So I said, I don't want my name there. But if you want me to contribute some medical information, I'll contribute. And then you can put my name. But I won't give money. He's been asking for $10,000 first. And then I don't know what he does with all the money. He must be asking.
Then he comes to 5,000. Then he finally, at the end of the day, when the candle is about to be blown off, he says, "Give me at least 1,000."
No, he asked me for 500. When I was in Bahrain, he said, "You can't even give me 500 pounds." I said, "I find it difficult." So what can I say? I didn't ask him for what. You just give it to you are capable of doing that. So I said, I'm capable of other things, but not giving money around.
Okay, Dr. Mahroof.
Dr. Mahroof Sahab and Dr. Siddiq Bhai, See, the earlier we start counting the money.
Inshallah.
That's
Inshallah.
that's what it is. And inshallah, doctor has the connect. He can get all the licenses and everything through. We have got to look at it on a positive note, and the time is not there. We have got to, because in Dubai they have mushroomed, in Dubai, but in Saudi Arabia we don't have a single unit which is there.
Yeah. Saudi Arabia, only positive thing about it is it's the largest country in the Gulf.
Yes, absolutely.
2,000
All
square
Gulf,
kilometers. No
yeah,
country is as
all
big.
countries, all Gulf countries put
Take
together.
Qatar. They may be the people may be rich, some of the people, but Saudi Arabia is the largest country because it has the largest number of Arabs in the Middle East.
Yes.
And at the same time, they can afford and they need it.
Not only that,
Yes.
they have a unique condition which I mentioned earlier. With every human being in the world will want to come as long as he is a Muslim.
Yes.
It is, name it Barcelona, name it
Anywhere, any part of the
anywhere
world.
in the world, yeah, they will come.
Yeah.
But
The other thing,
if you take any other country, not everyone wants to go to that country.
Yeah.
Yeah.
Correct.
The other important thing, doctor, is people with blockages of heart, people with
That's right.
low ejection factor. There are
That's
hundreds
right.
of them. There are lots of problems after this COVID. There are a lot of youngsters who are passing away. For those people, that ECP machine is going to keep our center busy. At least we will be servicing 8 to 10 patients per day.
Wow. That
Okay,
alone is
and
a massive.
each patient will pay Indian rupees 4,000 rupees per session.
Wow.
Okay, so if you have 10 patients, it is like having 40,000 rupees in a day. So if you are working for 25 days, you can just imagine, what is the kind of money we are going to make.
We will be working 24/7. Yeah.
Yeah, this will be working for ladies separate and gents separate.
Yeah.
8 and if you take minimum 8 and 8, 16 patients if you are servicing per day for only EECP. There are hundreds of machines similar in USA. In all the states of USA, they have got these machines, and these machines are FDA approved.
FDA approved, huh?
Generally
Yes.
what is approved in USA is approved in KSA. That's it. That's the rule of thumb.
Yes.
Yeah. Because they just follow the footsteps of USA, Australia, USA, Canada, all three places.
You said 4,000 Indian rupees?
4,000 Indian rupees is how much is Saudi divided by 23?
Yeah, 168 Saudi riyals.
We can charge 200 riyals per session. When you give them a package of 35 sessions, every patient needs about 35 patients, 35 sessions.
35 sessions, yeah.
Yeah, 35 sessions spread
How
over.
many, Dr.
35 sessions is
Aslam
7,000
Sahab,
riyal.
Aslam
Yeah.
Sahab, how many Indian rupees are in a real?
23.
Yeah.
23. Dr. Mahroof, what you have used, please?
What is this? Indian rupees?
Yes.
In a riyal?
Yes.
Okay. 23 rupees, 23.77.
That's fine. Okay.
So
okay, I think we call it a day now.
This is one. OCAT, we can have healthy people, unhealthy people, anti-aging, everything is covered under this OCAT. And we can put this as combo therapies. We can keep it as combo therapies. Then you have got vital therapy.
No. Let's not discuss all that, but just put the list of therapies that are giving.
After
that, you can work out the combinations accordingly. For
that we will
example,
work it out.
I have my meals today. I took 2 eggs in the morning and 1 tea, and that's it. And then lunchtime I had just now I had a sandwich, and that's it. And I will take my vitamin D and vitamin E now, and sleep. So if you start formulating like this, eventually your breakfast and lunch and everything will be organized. I take vitamin C in the morning and midday. That's it. So
Okay.
you organize something for each person and you give it. That's it.
Yeah.
And they will set it right, and it is part of the, we'll print out. They can say, I am so and so. What is my today's lifestyle activities? Boom, comes out, including their food and the activities. And walking, they say, is good. It's not good. Instead of walking, the push up on the wall is much better.
Also, yeah.
So I think I am collecting all those information. I'm making presentations, and this is my part-time job I'm doing.
Dr. Mahroof,
Yes.
you have to please share the list of books that just a list.
Yeah, I have already told somebody to do it. Anyway,
Yes.
they will be doing it. And these books are excellent.
Yes.
So we look forward, Doctor. I wait for Saqib Bhai and Dr. Mahroof sir. Once you get the things in place, once we get started, then we should not stop. We should move
No,
on
no, no.
a very, very fast track and
We
let us
don't
have
have
this
the
in
word
place.
stop.
No, because we need to be aggressive. If things have to happen, it has to happen. That's
Yeah.
all.
Inshallah. Thank you, Aslam
Inshallah.
Saab.
Jazakumullah
Right, sir.
khairan.
God bless
Keeping up
you.
so late. It's already
And have a good night.
10:30 for
And
you.
another important thing, Dr. Mahroof and Saqib Bhai, we can
Ji.
bring this lady from Italy, Mariam, who
I
can
spoke
come
to her.
in. Yeah, she can
I
come.
missed a meeting with her, and
Mm.
and then she was not well. So I tried to
Yes.
arrange a meeting. She didn't. I told her, when you are well, you let me know. We'll arrange a meeting.
Yes.
Maria can be very helpful.
See, because she can take care of the women and men health center.
Right.
We can
That's
have
it.
that
That's it.
particular department. She is very capable of handling that. Because I have seen hundreds
Let me
of
send a
Saudi
message and
patients.
see whether she can come for a meeting tomorrow. If she's coming, we'll have just a brief meeting. Is that?
Yeah, we can do that. Tomorrow
Yeah.
I'll talk to her and try to see if there's
You ask her
something.
what time is she available, and you let me know. That time I will
Yes.
arrange it.
Yeah,
Okay?
I'll discuss it. Yes, I'll
So if you
talk.
tell me in the
and I'll
morning
put it up.
sometime, we'll arrange it sometime in the
Yes.
evening. Yeah?
Most important thing, without documentations, sign up with Saqib. See, because verbal discussions, it doesn't hold
No.
good.
I will draft the MOU and send it to you.
Because today when he talked to me, he said that, Aslam bhai, when I have told that, yes, I have agreed. No, I said, no, let us have everything documented. It should be
That's right.
documented.
Very
Without
Agreed.
document, nothing happens. he said.
Aslam bhai, let me tell you. Up to now, whatever we discuss is being recorded.
Yes, sir.
Yeah, when I close this now, immediately one thing will come. I will send it to him, and he can send it to you. And then
Okay.
you will have a look at it, what we discussed.
Yeah.
Yes,
And
sir.
I will develop
And
the
right
minutes
now,
from there.
this is also recorded.
Yes.
Yeah.
Thank you so much. Take care of yourself. It was a pleasure having us on board.
Thank you
Safe
very much.
flight.
Thank you.
Okay.
Thank you. Thank you
Okay,
very
Good
much.
night.
Good night.
Assalamu alaikum.
Good night.
Right.
Good night.
Warahmatullahi wabarakatuh.
Dr. Mahroof, please go to sleep.
Yes, I will.
Have your supplements and go to sleep.
Okay. Thank you.
And I have to also record, which I failed to while you were with me, your routine 24/7, and
I
obviously
give you.
what you do
give you.
monthly basis, fortnightly basis,
I know.
6 monthly basis,
I'll
quarterly
give you that.
basis,
We
annual
have to do that.
basis.
In
Yes.
fact, I'm developing for my wife as well.
Yes. So I have to do that. Okay.
Yeah, okay.
Yeah.
We'll do that.
Yeah.
Okay. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum assalam. And obviously, please forgive me if anything has gone
No,
wrong.
no.
Yeah.
You are a different type of jewel that you don't wear on your neck.
Very, very kind of you, and all the very best for you. Thank you. Take
Okay,
care.
Jamal.
Allah
Masalam.
Hafiz.
Allah Hafiz.
Allah Hafiz.
Oh, what the hell is this?